Good morning, everybody, and welcome. Thank you for joining us from everyone across the country. My name is Eric Sandy. I'm the board chair for Health Excellence Canada and the president of Medivy Health Services. I'm grateful to be joining you today from Toronto, which is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa-Wendat, the Haudenosaunee, and the Wendat peoples. It is also now home to many diverse First Nations, Inuit, and Métis. The land now known as Toronto is covered by Treaty 13 with the Mississaugas of the Credit. I encourage everyone to take a moment to reflect on the traditional territory from which they're joining and to share that acknowledgement in our chat. I'm honored to be the chair of HEC. In my professional life, I work for a community healthcare social enterprise with over 5,000 clinicians and support staff who wake up every day thinking about how to improve the lives and journey of the patients we serve. We work in almost every province in Canada, privileged to serve many Indigenous communities as well. It is wonderful to work with a similarly dedicated team at HEC and to be inspired and learn so much from them about safety and quality. It wasn't that long ago that we launched Healthcare Excellence Canada. It was March 2021. Working with many of you as at the Canadian Patient Safety Institute and the Canadian Foundation for Healthcare Improvement, we achieved a lot, but there is so much more we can do. Unintended harm in the health sector remains the leading cause of death in Canada, and there are gaps in patient experience and outcomes, care team well-being, and value. The pandemic has shown us that we can rapidly scale innovations such as virtual care and COVID-19 vaccinations. We knew that by coming together, our two organizations could create a greater capacity to support partners like you. We could listen to evidence and experience and spread best practices and innovations across the country. So today we're launching our new 5-year strategy focused on shaping a future where everyone in Canada has safe and high quality healthcare. I'm really looking forward to working towards the same with my board colleagues, staff, and partners. It's really worth celebrating having reached this important milestone. And on behalf of the board of directors, I want to thank everyone who contributed and all of you for joining us today. And now I'll turn things over to Healthcare Excellence Canada's CEO, Jennifer Zellner.
Thanks so much, Eric, and a huge thank you to everyone as well for joining us today. My name is Jennifer Zellner, and as Eric said, I'm the President and CEO of Healthcare Excellence Canada. It's my job to start us off with a few housekeeping things, and then I'll move on to the substance of our conversation quickly. So just a reminder that simultaneous interpretation is available for today's session, both the main session that's happening now, and then we'll have 3 concurrent sessions and will be available there as well. To listen to the voice of the interpreter, please select the language of your choice from the interpretation button on the Zoom menu. Si vous veuillez participer aujourd'hui en français, veuillez appuyer sur le bouton Interprétation dans votre menu Zoom. Today is a 2-part session. We're starting in plenary now to introduce the strategy, and then we'll move on to 3 concurrent discussions, and instructions for how to do that will be provided later in the webinar. Just a reminder that we are recording today's session, so it'll be available not just to those of us on the line today, but also more broadly, and to invite you to both introduce yourself in the chat as Eric did, and to place any questions or comments or suggestions into the chat as well. We will be monitoring that throughout the webinar. So with those housekeeping items out of the way, it's my pleasure to turn now to our strategy. And strategies, as you know, are about both what you're going to do and what you're not going to do, that clarity of focus going forward. And I'd like to join Eric in thanking everyone who got us to this point, helping to guide us in terms of shaping the strategy to really power more change together with you. And look forward to working with all of you and colleagues across the country. And we've even got people joining us today from around the world to be able to move forward, to really advance quality and safety, and not just in small ways, but the whole reason for us coming together as an organization was to be able to better match the scale of the solutions that we could offer and work on with partners to the scale of the challenges that we face. And so that's what today is all about. It's about joining together those who have a shared commitment to common objectives, who have a shared set of values, to be able to move forward together for the next 5 years. And just before I turn things over to our next speaker today, just wanted to take a minute to reflect on the why. And it's never been more obvious than now during the pandemic and as we move through the waves of the pandemic, that the quality and safety of healthcare affects us all. That it's so important to have points of light, innovative approaches that occur and pop up in different parts of this country. But it's also critically important to be able to spread proven innovations and scale them so that they reach everyone who can benefit. Because we don't want it to be a situation where you have to be the lucky person in a given area or in a given practice to be able to benefit from positive change, but rather the opportunity to promise that to everyone. Solutions that fit their needs, their context, and that provide high quality, safe care. And that's what our strategy is all about. It's about how do we move forward together to that promise that we all share, that potential that we all share. And to start us off in a good way, it's my great pleasure to introduce Denise Mcquaid. Denise is a Métis elder and has been working with us over a number of years, holding our hands as we navigate new spaces and new environments and helping to start us off today and start off our strategy in a good way. So Denise, let me turn things over to you.
Merci, Jennifer. Bunmatan, Denise Mcquaid, the Shinnikishan. So good day, my name is Denise Mcquaid. And as Jennifer said, I'm a Métis elder who's worked as an Indigenous partner and advisor with both Canadian Foundation for Health Improvement and Canadian Safety Patient Institute, and now Healthcare Excellence Canada. As I was thinking about Healthcare Excellence Canada, I was really thinking about what was the reason why I wanted to have a relationship with the organization. And so I began to think about how they have the ability to hopefully implement and support the implementation of the kinds of changes I would like to see as an Indigenous woman in the healthcare system across the country. And so I thought long and hard about what is it about Healthcare Excellence Canada that makes me believe that that can happen. And I began to think of them as being very much like an eagle. And now an eagle has a lot of teachings from an Indigenous worldview that I won't have time to share with you this morning in our brief time together. But what I want you to think about in terms of the eagle is that the eagle can fly very, very high. And through their bird's eye view, they have this ability to see incredible detail from the highest point. And so they're more special than other birds in the sky. They have that eagle eye vision that some people have often heard about. And that's how I see Healthcare Excellence Canada. Like the eagle, you have the ability to fly across the country. You can see into the provinces, the territories, Nunavut, and you can see what's working best. And you can see where the challenges are. And like the eagle, you can fly back to home base with all of that knowledge and information. You can give us the big picture. But you're also positioned with human resources and the mandate to do the kinds of things that I can't do when I'm on the front line of healthcare delivery. You can do research, you can do literature reviews, you can bring together like-minded people to have important conversations. You can build documentation, educational webinars. You have all kinds of capacities and ways in which to get the message out about the best of this collective thinking. And it really excites me to think that I could be involved with an organization that has that capacity to not just bring what I think works best at my regional level or my home community, but the best thinking from across the country. and often beyond as you study what's working well in other places across the globe. And so as we think about the focus in your next 5-year strategy, the care of older adults, the care closer to home and community, and then the pandemic recovery and resilience, I also think about another important Indigenous value, and that's one of reciprocity. For us as Indigenous people, it is all about being relational. And it's about reciprocity. It's about everyone in our circle bringing forward their strengths and gifts in a relational way that helps us to grow and make things better for the collective, or in this case, Canadians accessing healthcare across the country and Canadians delivering healthcare across the country. And so I encourage you, as you have the opportunity to break out into smaller groups in these focus areas, to think about reciprocity, not just about what Healthcare Excellence Canada can do in terms of quality and safety, but what are the strengths and gifts that each of you bring to this process? And how will being relational with an organization that has an eagle's eye view help to move forward a better healthcare system for all Canadians? Merci, miigwech, Hookschem, and thank you.
Thank you, Denise, for your wisdom and your very inspirational words. My name is Blair O'Neill. I am Vice Chair of the Healthcare Excellence Canada Board and Chair of the Board Working Group that developed the strategy. I'm speaking to you from my workplace, hence my scrubs today, but I also acknowledge that I'm speaking to you from Alberta, which is Treaty 6 territory, a traditional meeting and gathering place and traveling route for Cree, Saulteaux, Blackfoot, Métis, Dene, Nakota Sioux, and indeed many, many other First Nations, Métis and Inuit, whose footsteps have marked these lands for centuries and centuries. Before I start, just a few words of introduction. I'm an interventional critical care and preventative cardiologist who's practiced across this country in Nova Scotia and here in Edmonton, Alberta. I've been a medical leader, passionate about quality and safety in our healthcare system throughout my career. At Alberta Health Services, I helped launch our cardiovascular and stroke strategic clinical network, and then subsequently, as Associate Chief Medical Officer, led all of our strategic clinical networks. These were engines of innovation and continue to be engines of innovation, scale and spread of best practices of quality and safety, and were founded upon the principles of incorporating the patient and family lived experience, as well as frontline clinician co-creation concepts. And that convinced me that the best performing healthcare systems incorporate these bottom-up designs. My passion for patient safety led me to join the board of CPSI. My desire to improve all dimensions of quality led me to join with others to continue the prospect of amalgamating CFHI and CPSI, ultimately multiplying the sum of our parts and our strengths into something greater. Today, I'm proud to be part of the launch of the bold strategy for that new organization, Healthcare Excellence Canada. Taking a step back, our strategic journey began about a year ago as we, building upon the proud legacy of our two founding organizations, took stock of where we were at that time. We enunciated our action-oriented foundational purpose, or raison d'etre, to shape a future where everyone in Canada had safe and high-quality healthcare. Reaffirming our values, we envisioned how we would work, what we would initially focus upon, the quality and safety lenses that we would apply to all of our work as we moved forward. And to do that, we engaged with our staff, with our many stakeholders, and with our diverse and dedicated board. Show the first slide. Basically, over the past year, we've engaged a lot. We've engaged more than 1,100 people to inform Healthcare Excellence Canada through our 2021-2026 strategy. We've used key informant interviews, we've used focus groups, launched webinars, public surveys, and social media campaign. And to boot, we did this through an unprecedented global pandemic that really made meaningful engagement with busy frontline providers and health sector stakeholders extremely challenging. And I really think it is deeply because internal and external stakeholders feel so passionately about this whole safety and quality business that the promise of our new organization will help deliver, that so many took so much time to contribute despite the distractions of this global pandemic. So on a personal note, I have to share that leading the strategy working group has been one of the high points of my career in quality and safety. As a healthcare leader and as a frontline clinician, knowing that there is a robust national resource dedicated to improving safety and reducing patient harm, as well as scaling innovations and best practices and quality across this country, is tremendously reassuring. Could not do this alone. I'd like to acknowledge all of my strategy working group colleagues from across this vast countries, whose names you will see on the slide for their dedication. They truly have been inspired and have inspired this strategy, along with the multiple other stakeholders and, of course, our dedicated staff. Further, I'd like to acknowledge that our efforts were bolstered by a patient partner advisory group led by Heather Thiessen and Linda Hughes, whose members, including Denise Mcquaid, who you've just heard from, who brought their tremendous insight and lived experience to us. Through their lived experience and that of their network, they really helped keep us focused, held our feet to the fire, and brought us to our key concept of our purpose and our raison d'etre. And Heather will speak more about them shortly. And of course, this moment wouldn't have been possible without the tireless efforts of our dedicated and skilled staff. And in particular, I'd like to acknowledge Maria Judd, who steadfastly supported me and the strategy working group, and who you'll also hear from shortly. Thank you for joining us for this exciting celebration of our new strategy for our new organization. And now I'll turn it over to Heather. Heather is co-chair of our Patient Partner Advisory Group and also is a member of our board strategy working group. Heather, please.
Thank you so much, Blair, and good morning, everyone. My name is Heather Thiessen. I'm here on Treaty 6 territory, homeland of the Métis in Saskatoon, Saskatchewan. I am a patient partner, has worked closely with the former Canadian Foundation for Healthcare Improvement and now Healthcare Excellence Canada. So I'm so excited to be part of this external launch for Healthcare Excellence Canada. Linda Hughes and myself, Linda, who is the former chair of Patients for Patient Safety Canada, and I were honored when we were nominated in the fall of 2019 to join the strategic working group of this new board. When we joined, we identified the need for and co-chaired a group of 10 additional amazing patient partners from across Canada to be part of the Patient Partner Advisory Group. You can see their names here. And boy, what a group they are. We knew that to do this work well, we needed to ensure that we had a broader voice of patient partners from across Canada to really help this strategic conversation. This group was amazing and always came prepared with many great ideas and comments to our questions. Linda and I could both bring these rich conversations back along with our own to the strategic working group. Some examples of where the Patient Partner Advisory Group truly did help shape the strategy for Healthcare Excellence Canada would be as follows. We recommended we change our framing from healthcare excellence, suggesting it's an event or an encounter, to excellence in healthcare, recognizing the patient journey and the many interactions with healthcare providers. In the values portion, change from partner effectively to partner meaningfully, because it is about meaningful engagements. And then finally, ensuring health and social needs include in focus areas of care of older adults with health and social needs. This has been an enriching and amazing opportunity So thankful for these 10 engaged patient partners working closely with the strategic working group of Healthcare Excellence Canada's board, and help me to see firsthand that they truly see the value of that lived experience, expertise patients, residents, families, and caregivers bring to every conversation, how we are stronger when we work together. So I'm going to pass it now to Maria, but thank you so much.
Thanks so much, Heather and Linda and Blair, and all of you who have helped shape our new strategy. And thank you for joining today to hear about our new strategy and about opportunities to work together. I'm going to take a few minutes to walk through our strategy, and then I'm going to invite you to join one of 3 concurrent sessions for a deeper dive into one of our 3 focus areas. So our new strategy for our new organization over the next 5 years is ambitious in purpose, but focused in scope. So working together with people across the country, our purpose is to shape a future where everyone in Canada has safe and high quality healthcare. Our strategy focuses, as you've heard, on care of older adults with health and social needs, care closer to home and community with safe transitions, and how we can support and shine a light on opportunities for pandemic recovery and resilience in our health systems going forwards, with quality and safety embedded across all of our work. So let's take a look in more detail. How we go about implementing our changes forms a crucial part of our strategy itself. So our role is to work with people across the country to find and promote innovators and innovations, policies, practices, or programs that yield greater benefit for people than the status quo, like those of Enhanced Recovery Canada. We'll be leading partnerships to drive more rapid adoption and the spread of quality and safety innovations across the country, like our Virtual Care Design Collaborative in partnership with Canada Health Infoway launching soon. In addition, we'll co-design, test, and share tools and resources that can make a difference, like those you'll find on our Patient Engagement Resource Hub. And by connecting leaders and teams from across the country, like in our Extra program and our Team Steps Canada program, we'll enable them to share and to learn and to improve and to sustain improvements together. And finally, by working with partners and other pan-Canadian organizations, we're looking to catalyze policy change. We'll advance shared federal, provincial, territorial health priorities by helping leaders share policy insights and identify levers for large-scale change, like the work we're doing with our Essential Together program and Essential Together policy guidance, and with Canadian Patient Safety Week coming up October 25th. And guided by people with diverse experiences, we'll foster learning and help support relationship building so we can advance cultural safety and humility, equity, and inclusion in our health systems. We believe it's time to reimagine care in Canada. And you do too, in what you've told us over the last year as part of our strategy consultations. And in setting priorities to focus on, your input helped us identify 3 key themes. Many people are concerned about care of older adults with health and social needs. And at Healthcare Excellence Canada, we'll aim to introduce new policies and ways of organizing and providing care and services that improve the experience and the outcomes of care by better integrating health and social services. And we have a growing portfolio of programming and long-term care with partners across the country. We heard that you want safe, high-quality care closer to home and community with safe transitions. Connections with primary care provider and virtual options are also important. I invite you to learn more about our Bridge to Home spread program and collaborative. And finally, working with others across the country, we're focused on how we can help build an effective response to COVID-19 and encourage increased resilience in our healthcare systems. While people and healthcare systems across the country have responded to the pandemic with tremendous innovation, we know the pandemic has exposed gaps, pre-existing gaps, and enhanced them in care and in equity. And we know many people across the country are experiencing high levels of mental distress, including those in our workforce. And together, by working together, we can not only recover from the effects of the pandemic, but take the lessons learned and the insights and the better ways of organizing and funding and providing care with and for more people forward to strengthen our healthcare systems and truly shape a future where everyone in Canada has safe and high quality care. Improving patient safety and quality is foundational to our work with and for the people who receive care and those who provide care. And we seek to ensure that their perspectives are reflected in everything we do. By listening to and engaging with people with lived experience, patients, families, caregivers, communities, we seek to ensure that their experiences and perspectives drive safety and quality in healthcare. And Healthcare Excellence Canada has a growing community of patient partners, including members of Patients for Patient Safety Canada. For people in the healthcare workforce, we'll seek to ensure that those who provide care shape how we improve care and that they see the value and the change and the impact on their work life. Is so important we consider that as we go forwards as well. And this ties to our focus on value, understanding what matters most to patients and linking that with money spent over their patient journey so that the outcomes that mean the most to them are what we're focusing on. And we have resources to share, like our value-based healthcare toolkit available on our website. And as we work to support people who set policy, implement policy, provide care, experience care. And we're working to support people in health systems to address racism and power imbalances, to help support and foster a sense of security and safety, to avoid harm, and to help distribute services according to people's needs. Seeking and supporting meaningful engagement with First Nations, Inuit, and Métis people helps to ensure that their priorities drive reconciliation, quality, and safety in healthcare. As an organization dedicated to improving healthcare across Canada, our values ground our work, and we're committed to forming partnerships that allow us to achieve more together. We're committed to innovating and promoting bold ideas. And we're committed to building trust, making evidence-informed decisions, and mutual accountability and reciprocity. And we're committed to embracing diverse perspectives and experiences. Here's our strategy, all on one page. I invite you to reflect on it, and it will serve as our guide over the next 5 years. And to everyone who contributed to shaping this, we want to say thank you. As Blair said, through a global pandemic, you made time to help us set a course for our new organization and for healthcare quality and safety across the country. And we've laid out a bold vision of shaping a future where everyone in Canada has safe and high quality healthcare over the next 5 years, and we can't do it alone. So please join us. Lots of ways to get connected, which are part of the slides coming up. And now we're going to go into some current sessions where you can join us for a deeper dive into one of our focus areas. In our concurrent sessions, you'll hear from HEC staff about upcoming opportunities, programs, tools, opportunities to work with us to improve care in these focus areas. You'll also hear from some of our external partners and collaborators about what it's like to work with HEC. And finally, we'll invite you for your thoughts and input about how will we know that we're making meaningful improvement in quality and safety in these focus areas over the next 5 years. So for each of these 3 discussion breakout sessions, we will have simultaneous interpretation. Our producers are now sharing links to the sessions in the chat box. And so if you'd like to join focus area 1 or 2, that's care of older adults or care closer to home and community with safe transitions, you'll need to leave this session and click on the invitation link either in your calendar or in the chat session. If you'd like to stay and be part of our conversation in exploring how we really ensure the lessons learned from the pandemic strengthen our systems and care for pandemic recovery and resilience, you'll remain with us in this room and we'll begin in just a moment. So with that, I would really like to thank you for your input over the last year, for joining us today, and for the work ahead together. As you head off into your discussions, I'm going to hand the floor over to our moderator, Jan Bird, Director of Health Policy for HEC, who will start us in our discussion. Thanks so much, everyone, and take care.